and it has to do with convulsion. We know convulsion can happen across all age groups, but it also happens in children. And there's something parents do. They put spoon in the mouth. Sometimes they burn the feet of the child. Sometimes they tell you to put onion and whatever. I want you, sir, to help us address this tonight. When a child is convulsing, how should the parent respond?
Okay. You are very correct, Dr. Fred, that convulsion, first of all, is a very terrifying thing for a parent to witness, especially if they've not witnessed a convulsion before. They literally think that the child is dying, because that is how it appears. Because the child is stiff, child is rigid, child is shaking, eyes are turned up, child is unresponsive. And it has not really helped, you know, that unfortunately in popular media and films, especially in Nigeria, once a person convulses like that, that's the end. The person usually ends up dying because maybe they've been poisoned or something. And so, and in all fairness to people, people have actually heard of people who have, you know, lost their lives, you know, after a convulsion and all of that. So it's a terrifying thing, no doubt about it. But when it comes to a child having convulsion, the good news is that most convulsions will stop by themselves before 5 minutes of starting. So convulsion starts now in a child, even before 5 minutes, the convulsion usually stops by itself. And nothing you can do at home can stop the convulsion. Putting feet inside the fire will not stop the convulsion. Putting onion inside the eye will not stop the convulsion. Crude oil, cow's urine, urine of an old woman, and these are things that I've actually seen people do. Pepper in the eye, pouring water on the child is not going to stop the convulsion. The only thing that can stop a convulsion is certain medications that should be administered in a proper healthcare setting, and the fact that the convulsion is going to stop by itself. That being said, if a child is having a convulsion, please make sure that they are as far away from anything that is dangerous. For instance, an open body of water like a swimming pool, any electricity or fire. Take them away from any danger. Lie them on their side so that if they vomit during the convulsion, then any vomit can come out of their mouths. Then make sure that they are not having any tight clothing on them, whether it is a belt, whether it is a cap, whether it is a tie, whatever it is, losing any tight clothing on them. Then please do not press them down. Pressing them down is not going to stop the convulsion, and it can actually even break some of their bones. Don't put a spoon into the mouth, because the risk of them biting their tongue and cutting their tongue off or swallowing their tongue is very, very minimal. Don't give them anything to drink like palm oil or agbo while they're having a convulsion. They can aspirate, meaning that the liquid is going to go into the wrong place, into their lungs, and it will be an even worse outcome. Take them to the nearest hospital, please. Some people actually would like to take those children having convulsion to the hospital that has the child's card. And sometimes that hospital is kilometers away from where they are living. But simply because that's where they gave birth to the child, they want to take the child all the way 10 kilometers. Meanwhile, there's a hospital nearby. So in other words, I'm saying every family should have a hospital as close to their house as possible for emergencies, so that you can take that child there, they can stabilize the child, and if you think that the child needs further care or evaluation, then you can now take to the hospital where the child was given birth to or circumcised, or where they have the child's card.
Thank you, sir. I want to ask, you mentioned there is nothing you can do at home that would stop it. Sometimes it could stop on its own. What should a parent do if the convulsion lasts for a certain period of time? I know that there are triggers of this convulsion most times for kids. What should a parent do so that this child does not get to that stage of having these seizures and the rest?
Okay. So when it comes to preventing, so of course, there are various things that can cause convulsions. One of the commonest reasons why a child will have convulsion is if they have a fever, which we call a febrile convulsion. Now, with febrile convulsions, the child has a fever. Sometimes the temperature is rising, is on the rise, and then the child has a convulsion. Now, there's a tendency for febrile seizures to run through families, such that if you take a history, sometimes you hear that, oh, about 20%, you might hear that, oh, this Naso Papa Bio, that this child's father or this child's mother too used to have convulsions when they were small, when they had a temperature. Of course, it is not every child that has a temperature that will go on to have a convulsion. As a matter of fact, it is a minority of children who have fever that will end up having convulsions. Sometimes, and of course, it's when it comes to convulsions with fever, children who have convulsions, while they're having fever, they just have a natural tendency in their body system and in their brain to have such convulsions. Now, the thinking used to be that, oh, if you can prevent the fever or if you can bring down the temperature, then the child is less likely to have the convulsion. Well, we are come to realize that that isn't always the case. As a matter of fact, it is not the case in a lot of cases, which is why we're now trying to emphasize the idea that please don't do the wrong things when the child has a convulsion. Because sometimes when there's a febrile convulsion, even before the child actually has a temperature that you can detect on their skin, they have a convulsion. And then the fever will now come. So meaning that sometimes the first sign that the child is having any kind of illness is the convulsion rather than the fever. What we are saying is that please don't say that you will not give paracetamol. Please give paracetamol to any child that has a fever, especially if the child is uncomfortable or if the temperature is more than 38.5 degrees. Give them a paracetamol or ibuprofen to bring down the temperature at the right dose. Please make sure that the dose is correct for the child. But we are saying that please don't feel bad or don't feel that you have not done your duty if the child still ends up having a convulsion, because we have seen that in majority of cases, no matter what you do, any child who has a natural tendency to have a convulsion with a fever will have the convulsion no matter what you do, which is why you need to be equipped with the knowledge to know what not to do and what to do when the child has a convulsion. The time we state is that if a child has a convulsion and it lasts more than 5 minutes, please move the child to the nearest hospital. That is the time frame we usually give to say, okay, please, if a convulsion has lasted for 5 minutes or more, move to the nearest hospital. If it has not lasted up to 5 minutes, we want you to still go to the nearest hospital in case the child has another one. Because sometimes there's a tendency that if a child has a convulsion now, they can have another convulsion within a short time after that. And in that situation, you want to be where the child can get care as soon as possible, rather than you being at home and being panicked. Yeah.